up as a bill is discussed. Okay, we'll move on.
You are now live.
Right, we are now live.
All
Okay.
right. Good afternoon. This is the Task Force on Accessible and Affordable Healthcare. This is our final meeting, and I'm Senator Ginny Lyons, and Representative Bill Lippert is the other co-chair. Our goal today is to have a discussion about and a vote, possible markup or edits, and a vote on the report that's been submitted by our consultant, Joshua Slen.
So, yeah, so I think that's our agenda. How shall we proceed? I think I'm not looking for, I think some of us participated in a presentation, at least joint presentation between Senate Health and Welfare and the House Healthcare Committees. Of course, Senator Ram Hinsdale and Senator Westman don't sit on that committee, but the reports have been submitted to us. And so I guess I would, Ginny, Senator Lyons, maybe we should open it up for some.
Yes,
comments.
let's open it up for questions, but Joshua Slen, do you want to say anything before we do that?
No, I think you can open it right up for questions. We've had conversations with all of the members about the materials. They've been out there in draft form and in final form for some time now. And there was a public hearing yesterday on it. So I'm happy to discuss it and whatever level of detail folks would like to get into. And certainly, as you all know, will be available throughout the session as well for more in-depth conversations on pieces that do get more conversation.
Okay, thank you. So let's open it up now then, and welcome Senator Westman. Committee meetings are going overtime like crazy right now. So
Right.
Sorry
yeah,
about that.
do not apologize. That's part of legislative life. So 3 hands went up almost simultaneously. I'm going to start and work across my screen. So I'm going to start with Representative Lori Houghton.
Thank you. I have a clarifying question. Are we talking today about voting on the report that the consultant provided, correct? Not necessarily a report of the task force. Is that correct?
That is accurate.
Okay, thank you.
Representative Donahue.
Thank you. That was exactly my question, because at some points it appeared to be that we were voting on a report from the task force. And this is just about accepting the consultant's report. It's not a report from us. Thank you. She asked my question.
Okay. Senator Ram Hinsdale.
Yeah, I think as we accept this report, I just have a couple questions for Josh, and maybe they were answered at the hearing that we couldn't, we weren't on the committees of jurisdiction. But Josh, which principles of Act 48 do you feel like were most advanced by the work that you did, would be one question. And two, what do you think is our charge in terms of working with the federal delegation and working with federal partners to try and advance something bigger picture that's going to need investment from the federal government, given that we had your expertise on reaching out to CMS and others? Like what do you think we need to be doing moving forward to garner that kind of big picture experimentation thinking within Washington again?
Yeah. Two sort of meaty questions. I'll try not to spend too long on them at this point, but not too little on them either. The principles of Act 48, I don't actually have them in front of me. They are in an appendix in the report. And I'm highly confident, though, that as we walk through those principles, that the combination of the four options addresses, if not every principle, the vast majority of those principles. And so I hesitate only because I don't have the full list in front of me, and it's a good size grouping of words on the principles. But as you know, that the options that are in that report affect every Vermonter at different points in their lives, and they affect them both with very specific opportunities to reduce cost to the actual payment of premiums cost, as well as to provide access to services that today not everyone has access to. And so I do believe that from an equity perspective, they're well-rounded and that they address people at all ages of their life and in all corners of the state. So there's certainly lots of other initiatives that could be done that you could say similar things about. These are ones where there are opportunities today in Vermont, not the only opportunities as we've discussed. But I believe that you have a blanket coverage on principles of Act 48 with always the ability to take targeted criticism, and that's appropriate, and happy to have those individual discussions. On the federal delegation, someone once told me, everybody is an independent actor. So that is never more true than in the legislature here and at the federal level with our delegation. And so I do believe that there is an important role for the legislature in talking directly with our delegation for priorities that require federal assistance. And so where there are waiver opportunities or where there are sort of larger, from your perspective, big picture. So where can we, really be in the vanguard for moving things? There's that opportunity. I think when you look at the four options, the one that so the most forward-leaning conversations might be necessary on are around the public option and how we could target that in Vermont to the area where we really have need. The other options that we have, although I would recommend that we do ask for federal support for the Medicaid portions, the populations that are served by those options, and I think that's a no-brainer to ask for and easily achieved as a yes from the federal government, because we're expanding existing programs that they are already supporting. So in those other instances, and then with the cost growth targets, certainly should be aligned with the all-payer initiative, and I believe would be very supportive of that reapplication for that waiver on that front. But we can do cost growth targets and move forward with those without a big, the delegation doesn't have to take action on that for us. On the public option, that's the one I would focus on, as depending on where we go with that, you could push the envelope there more aggressively and need a little bit of understanding from the delegation so that they can weigh in support of.
Does that answer your question, Senator?
Yeah, I mean, I guess it leaves me still with a remaining question as to, is the governor's administration the right messenger to Washington around this? And do you think that through line is strong enough right now on these issues that we're trying to advance, or advancing this North Star that we've been talking about for healthcare to continue to bring down?
So thank you for that question. And obviously, it's not something I think that the task force has weighed in on, but I know that Representative Lippert and I, from time to time, have communicated directly with our congressional delegation, which is so key in ensuring that legislative interests are represented. So your point well taken. It's more of a question outside of the task force, and I'm happy to talk with you about it going forward. Okay. Any other questions regarding the report? Representative Lippert, you looked like you were ready to.
Yeah, well, I'll just say a few things. So I want to just say that it's interesting. It's very interesting to be back in session and delving into the complexities of healthcare, health insurance, which our committee has been deep in for the last several weeks and past several days as well. And so, and to both notice where we have set things in motion that have actually made things possible. And as Joshua has noted on a number of occasions, we've actually done a fair number of things in Vermont, but we're always wanting to do more, and we do want to do more. But I'm just going to say this. I think there's a great deal of complexity in what we've put together in this report. I think it's hard for us to sometimes get the perspective of what it means for someone who's not eating and drinking healthcare policy to hear something and say, oh yeah, well that's an obvious step forward, or that's a good way to move or way to go. And so where I am at this point is I am interested in having us take the results of this task force work and this report, step back and look at it more carefully in the broader context of initiatives that are.
You're frozen.
I'm frozen?
Now you're not.
For a second.
For a
Okay.
second. Keep
Sorry,
going.
I couldn't tell on this end. So I think what I was saying is that I'm looking forward to stepping back, looking at the recommendations that are put forward in this task force in the context of everything else that we actually are in the midst of, both at the federal level, and as Senator Robbins Hinsdale said, there's also a lot of unknowns at the federal level, but we're in the middle of some initiatives at the federal level. And we heard reports about that today in terms of accessibility and affordability, the extended premium tax credits, which I mentioned before. We still have an opportunity to make sure that all Vermonters who are eligible access that. And I think the numbers that we heard today in committee were that Vermont may be benefiting as much as in the order of $65 million, or in a range that's a huge number of immediate access. So I don't want us to get lost in saying, well, these are new initiatives we should look at, without recognizing that we're in the midst of some initiatives already. And so I'm looking forward to stepping back, taking this in, thinking about it, understanding it even more, and then, arriving at some decisions about how and what to move forward. So I'm prepared to accept the report without wanting to have there to be a misunderstanding that I think, yes, we should do this, we should do this, we should do this, and that we should do it this today or next week. But I think there are pieces of additional information and that we've identified here and potential interventions. But I wanted to make sure that we're doing this in the context of everything we're already in the midst of.
Thank you for that. And as folks know, the decision has been made that working with the report will begin in the Senate. So that leaves it to us to do that reflection and that work relatively soon. And we also understand that this is an extremely complex area. And we, as Joshua has indicated, if we did everything in that report, or at least put the wheels in motion to begin those things, we would be affecting every single Vermonter. That's a good thing. But there are some things that we can't do, and we can't affect change for some of our self-insured programs.
Right.
And there are some things that we can't do without holding the hand of the federal government. And so that all is going to be very important as we take this report forward, should we approve it. And I would like to say that there are a number of initiatives that, as a result of the work that we've been doing, there are a number of bills now out in committees that relate very much to the next steps. So maybe some of those bills will cover some of the work that we're doing, and we can focus on some of the bigger questions. So my committee is interested in understanding the discrete recommendations that can be made legislatively that come out of the report. And we'll be working on that, and we're going to start working on it tomorrow. So I know, and then we'll be working with the House committees to make things happen, hopefully. So committee members, without prolonging the meeting at this point, I'm looking for a motion, if I could, please.
I see Representative Donahue has a hand up.
No, she's got an old
It was
hand
not
up.
for a motion.
Oh,
Oh,
well,
it's not for
okay, good.
motion. Well, Representative Donahue, go ahead then.
Sure, I just wanted to kind of, my perspective is, I'm actually really concerned in terms of, communication generally of what we're doing, because the term, we're approving the report. If that means we're just saying, thank you for the input, these are things we're going to consider, that's very different from saying the task force is endorsing these, or that this is our report as a task force. Because I think, if I don't have the language in front of me, but I assume we had a directive in the original legislation that we were supposed to report back, and we haven't done a report. I think that approving this report, even if we try to clarify that, that's going to be interpreted as we're endorsing this, we're approving this, this is our report, and I would not vote in support of that as a motion.
What I'd like to do is to ask for some clarity from Jen Carby, if you don't mind, on the recommendation that is what is in statute, and then we can move from there to an appropriate motion, perhaps.
Thank you. Jennifer Carby, Legislative Counsel. So I have looked at, and I can put up on the screen if it would be helpful, or just read to you, the language from your charge says, as far as the reports, the first part was that on or before December 1st, 2021, the task force and the consultant must brief the leadership of the House Committee on Healthcare and Senate Committee on Health and Welfare of their preliminary findings. And then on or before January 15th, 2022, the task force and the consultant shall present to the House Committee on Healthcare and the Senate Committees on Health and Welfare and on Finance their findings and recommendations regarding the most cost-effective ways to expand access to affordable healthcare for Vermonters without health insurance and those facing high healthcare costs, and the various options available to implement these recommendations.
So, Jen, to clarify, then this would serve as the consultant's report, and by accepting it, it becomes our report.
I think there are different ways to interpret it. The way the language is phrased, it does not, it identifies the subsection as titled reports, but this is really about briefing and presenting to committees, chairs first and then committees. And it is phrased as the task force and the consultant presenting their findings and recommendations.
It's a presentation. So that represents the slide deck and then the more in-depth report that's been put together. So I think that is reassuring to me, at least. And at this point, is there discussion or further questions? Are there further questions or is there discussion? So hearing none, then I would ask for a motion from the task force. And what, is there a motion to be made? Is there someone who can do that? Because if you don't, I will.
Well, why don't you frame the motion? And I think, no, well, I mean, I'll put a motion forward
Okay.
that we accept the report from our consultant and the recommendations, and that we continue to take them under advisement as we look forward to continuing making
Period. I
healthcare,
just say we continue
Period.
to take them under advisement, period.
period.
Yeah, fine. That's fine. So can you say that one more time?
I think that we accept the report to the task force of our consultant's report, and then we continue to take it under advisement.
Okay. I don't know. Do we need a second?
I'll second it.
Okay, thank you. We don't need it, but we got it. That's good.
Yeah, you got it.
All right. Discussion committee.
I see Representative Donahue has a hand.
Yep, go ahead.
Yeah, you know, as precisely worded, I would not have a problem with supporting that, but I continue to fear that given that our directive included, you know, our findings and recommendations, I am not willing to adopt these as recommendations from the task force as a member. And so I just think that's going to be, it's going to be misinterpreted that way. So I'm just explaining, you know, I can't support that, that messaging.
Okay, any other comments? There's a motion. The motion is to accept the report, the consultant's report, and that we will consider the report going forward. How did you say that last part, Bill? That was very well done.
Take it under,
Take it under advisement. Okay.
Can I ask a question?
Sure.
Can you just share again the pieces that are already in legislation that's being considered in your committees, or?
Well, I'm thinking about the parts, some of the things that we don't have directly in there, and that is the workforce report, the health equity task commission report, the PBM bill. We also have some primary care legislation that is being discussed. So there are a number of things that either become vehicles, an attachment for other ideas that are included in the report, or standalone legislation that we could support. Yes. And during the joint committee meeting yesterday, the question was asked, and Representative Donahue, you may have asked this, is this report from the committee or the consultant? And the report is clearly from the consultant, but it's based on a lot of work and discussion with task force members and at our committee meetings. And we made some decisions along the way. I want to remind us of that. We made some choices. We made choices about short-term and long-term. We made decisions about those things which could be done in the state of Vermont conveniently and easily, We made decisions about putting off longer term, but by longer term, I'm meaning beyond 2 years. So 2 years is a pretty significant time, I think. We made decisions about putting things aside because there were bills or there was work going on outside of the task force. So I don't think that I do believe that our work has been informative in this report that's coming to us. And I do think that as we go forward with presentation in committees, that the committees will be able to make further decisions. This is nothing here is written in stone. It's like any other report. So I don't feel uncomfortable in the same way that you have suggested, but so be it. That everyone has their own sense about this.
And I'll just mention for Senator Hinsdale's, I think, specific question. There were 3 things mentioned that we had talked about along the way, that the postpartum expansion, which is
I forgot that one.
yeah, which is in the governor's recommend, but with that you need to understand more fully to understand what's really recommended, but that we understood would be coming forward. Clearly, the remote access to care, which we've collectively done lots of work on around telehealth and other remote access. So we chose not to try to go deeply there. And also broadband expansion, which was a basic fundamental piece of access to healthcare in these days. But we knew that that's beyond the scope of what our committee is doing, what this task force was doing. And then that there was also around prescription drugs, the pharmacy benefit manager regulation, which we know there are bills in front of at least our committee, possibly both committees. And those were things which we said, well, they rose to something that we were very interested in, but we did not put direct task force attention on because we also knew those initiatives were underway, as well as the general, as Senator Lyon said, the general workforce, healthcare workforce issues, et cetera.
Okay. Can you please state your motion one more time for the task force, and then we'll entertain a vote.
Okay. I think my motion consists of, I move that we accept the report from our consultant as presented to the task force, and that we take these recommendations under advisement as we continue our work for affordable, accessible health.
Under advisement.
Under advisement,
Okay.
period.
Yeah.
I guess there was a period there.
Okay. That is the motion. I don't see any further hands. All those in favor, put your hand up and say aye, please.
Aye.
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 All those opposed?
Okay.
Thank you. Okay. So the vote carries 5-1, and we have accepted the task force report, and we are taking it under advisement. And I thank you all. I know this is giving us, how many meetings were we given in statute? Was it 5?
5 or 6.
5. And the work that we organized in August, and we had a half a meeting, so we extended one meeting. We had another half a meeting. This isn't even a half a meeting. So we haven't really had the in-depth time that one would expect if one's trying to turn the Titanic away from the iceberg. Building affordable, accessible healthcare is not an easy task. And I want to say thank you to each one of you who has worked on the task force. Greatly appreciated your questions and your input. And more importantly, I guess, and most importantly, is thanking Joshua Slen for his work in putting the report together, as well as our JFO and Ledge Council folks. They've been really helpful. And so we will take the task force report under advisement in our committee. It's my understanding that the Senate will begin work on this first, and I ask each of you to stay engaged with us as we go forward on this. And I know we'll be
Absolutely.
meeting together again.
Yes.
And we will invite Senator Rom Hinsdale and Senator Westman in, because they are our friends, our healthcare friends.
Right. Right.
Just friends outside of your committee.
Right, right. I just also want to note that we've done this in the midst of a pandemic that's required extraordinary adjustments along the way, including not being able to meet because of a special session that was called.
Oh, that was devastating. Honestly, thank you for
I
reminding
mean,
us.
just in terms of
yeah.
time frame, so people
Yes, it
understand
was
that
terrible.
our plans have been to move this forward and have opportunity for discussion earlier than we have had the opportunity to. But we will, as I say, we're engaged in this longer term. This is not the end or the beginning. So thank you all.
Okay, thank you all. I think that we have completed our task as a task force. So we can adjourn and
Thank you.
see you around the halls.
Right. On Zoom.
Take care. Charlene, we can go